Hello, I'm with Dr. Sarungpong, cardiologist. We're at ViMUT Hospital and you are watching Health Matters Asia. Dr. Sarungpong, are you seeing a rise in heart disease in Thailand?
Heart disease, or in the another meaning is cardiovascular disease, is the major and significant concern of the health problem in Thailand. This disease is the leading cause of death in this country, and it leads to debilitating condition, especially if the patient develops heart failure, acute, sudden onset of heart failure, or chronic heart failure. And because the heart pump the blood into the circulation throughout the body, so if you develop the heart disease or even the blood vessel disease, you can cause the patients can cause the high blood pressure and heart disease. And if I need to say about the incidence of the heart disease, it is quite difficult to estimate the exact risk of or exact incident of heart failure, but if I need to pronounce on the such as only heart failure, it is believed that maybe 5 to 7% of total population in Southeast Asia or in Thailand will encounter with heart failure. And if the patients develop heart failure, they will die in 5 years after diagnosing heart failure. So this is why I am here, being here for the Health Matter Asia.
That's really surprising that it's one of the largest diseases and epidemics in Thailand. I'm quite surprised by that, and it's shocking. What's the cause of cardiovascular disease?
Cardiovascular disease may comprise from the several risk factors such as aging process, that is the non-modifiable factor, right? And heavy smoking, uncontrolled blood pressure is so-called hypertension, uncontrolled hypertension, diabetes, or high lipidemia, hyperlipidemia. If these factors cannot be controlled in the patients, in the population, it can raise the problem. For these factors, this is called atherosclerotic risk factors. It can cause the blood vessel problem, include the blood vessel that supply the heart muscle and the blood vessel that supply throughout the body.
If I started to develop symptoms, say chest pains, am I able to come over to ViMUT Hospital and have a checkup? How do we diagnose the state of my heart?
For the stage or severity of the heart, you should do a regular checkup, okay? And you should see the doctors, the heart doctors, to check the lab, to do a physical examination and obtain your history about the pain, about the symptoms. And the doctor will diagnose your condition that you have true heart disease or else, okay? And we may send them in further investigation, okay, such as the electrocardiogram is the electricity of the conduction of the heart. We may do the echocardiogram, is the ultrasound of the heart, okay, do a chest X-ray, including other labs for diagnosis. And we may offer the advanced technology such as CAT scan of the heart or MRI of the heart, okay, including a choreoangiogram or anything else to diagnosing and treating the condition.
With the checkup with the heart, is that part of a bigger health checkup program at ViMUT Hospital, or do I have to book a specific cardio health check?
The patients who walk in the hospital, okay, can book to specifically meet heart doctor or schedule for do further investigations in the specific situation.
So if I came here and I was having, say, a general annual medical check, could it be picked up, or would I specifically have to ask for a cardio checkup?
Firstly, the primary physician, primary doctor may do a physical examination, obtain you the history that related to your heart problems, such as chest pain, exertional chest pain, exertional shortness of breath, okay, and do an EKG if there are some abnormalities such as abnormal history and physical examination or abnormal EKG, the primary doctor will send you to the heart doctor. Yeah, okay, and the heart doctor will offer the further investigation for diagnosing any heart disease later.
And as a cardiovascular specialist, what's your recommendation to us in terms of lifestyle choices for prevention?
I would like to give you an acronym should do. Okay, it started with S. S is stop smoking if you are currently smoke. Yeah. H is hypertensive control. If you are being diagnosed with hypertension, you should seek medical attention to getting the appropriate medication for treating and appropriate monitoring the blood pressure. O, like obesity management. If you are overweight, okay, you should lose your weight. Okay, from scientific data, just losing the weight approximately 5 to 10%, you can have a significant benefit from the prevention of cardiovascular disease. U is like usual or regular exercise. Exercise is very good. Everyone know. Okay, for at least 150 minutes of moderate intensity aerobic exercise will help your heart. Okay, and improve your muscle strength training. Maybe a few times per week. Okay, will improve your heart function also. L is lipid management. If you are being diagnosed with hyperlipidemia, you should get the statin. Okay, it's the lipid lowering agent, or by your doctor, by your the heart doctor or PCP, primary care physician. Yeah, to lowering the lipid level. Okay. D, diabetes control. Okay. If you are, as you know, diabetes mellitus is the major and strong risk factor for heart disease. Yeah. Okay. So if you are being diagnosed with diabetes, you should see the doctor to control your diabetes, your glucose, your blood sugar. Okay. And do a checkup. Okay, regular checkup, maybe ViMUT Hospital. Yeah.
Dr. Sarungpong, cardiologist, thank you for being with us today. Thank you to ViMUT Hospital for being the host of this episode, and thank you for watching Health Matters Asia. If you like this episode, please like and subscribe, because your health matters.